Did you know that effective suicide risk screening can save lives? Today, we'll explore essential practices in trauma risk and safety assessment. This topic is vital for anyone working in mental health, especially with youth. Suicide risk assessment is a critical responsibility in mental health. It requires both a systematic approach and clinical sensitivity. The Ask Suicide Screening Questions (ASQ) toolkit, developed by the National Institute of Mental Health, offers a brief but powerful resource. This tool consists of just 4 questions and takes about 20 seconds to administer. Research shows that it identifies 97% of youth aged 10-21 at risk for suicide. Implementing this screening universally in medical settings is recommended. The Joint Commission approves using ASQ for all ages. But, for youth, there are developmental considerations. Whenever possible, screenings should occur without parents or guardians. This approach encourages honest responses from the child. If parents refuse to leave, the screening should still proceed. When dealing with younger children under 8 years, validated tools do not exist. In such cases, a full mental health evaluation is essential if there's a suspicion of suicide risk. The ASQ toolkit includes clinical pathways designed for various settings: emergency departments, inpatient units, and outpatient clinics. If a screening yields a positive result, having clear clinical pathways is crucial. The ASQ toolkit suggests a brief suicide safety assessment, BSSA, conducted by trained clinicians. This assessment determines the need for a comprehensive mental health evaluation. All patients who screen positive should receive a resource list containing crisis support and follow-up information. Timely intervention is vital. Research indicates most people who die by suicide visit a healthcare provider shortly before their death. Therefore, it's crucial for all clinical settings to have established protocols for managing at-risk patients. These protocols should specify who conducts follow-up assessments and document procedures. Comprehensive safety assessments must evaluate multiple domains. This involves looking at risks to self, others, and potential vulnerabilities. Elements of assessment should cover historical factors and current, changeable aspects. Vulnerable populations require particular attention concerning exploitation risks, including financial or psychological abuse. Instead of relying solely on checklists, clinical judgment is essential. A thorough understanding of each individual's history and circumstances informs better assessment. Accurate documentation is key, clearly distinguishing between facts, observations, and professional judgment. In summary, an effective suicide risk assessment involves systematic screening, clear clinical pathways, and comprehensive risk evaluations. Remember, the goal is to provide timely support to those in need. If you're in the mental health field, consider implementing the ASQ toolkit in your practice. Share this information with colleagues and help create a safer environment for those at risk. Together, we can make a difference.